Well, hello and welcome to the first episode of Nevabupas Health Insurance presents Times Network Living Room Conclave India Health Mission Season 3, co-presented by Sensodyne, featuring a discourse between leaders from both the government and the private sectors across the entire nation, in fact the entire healthcare sector of India. Times Network Living Room Conclave India Health Mission is a series of episodes that aims to inform, aware and educate our national audiences on the key issues that can safeguard and protect lives. In fact, this year our focus is going to be on building a healthy India. In today's fast-paced world, it's easy to overlook the most important asset that we have, our health. Well, life has been full of demands, from work and family to social commitments and personal goals. However, none of these pursuits can be fully realized without good health. In order to make a healthy India, we need to ensure access to the best healthcare from all Indians. In fact, every Indian should get the best treatment possible. In fact, data has revealed that a vast majority of the population pays out of their own pockets for medical expenses, increasing the existing financial burden. Another statistic suggests that more than 50% of the Indians suffer from some form of oral health disease, yet only 5% of Indians visit dentists. There is a very strong connection between oral health and various systemic health conditions. Securing lives and building a healthy India is the need of the hour. In fact, today we have a distinguished panel of experts who will help us understand and realize this. Allow me to welcome here on the show, we have Navneet Saluja, the Managing Director of Helion India. We have Krishnan Ramachandran, MD and CEO of Nevabupas Health Insurance Company Limited. Also, Dr. K.M. Gopal, who is the Advisor to Public Health Administration at the National Health Systems Resource Centre, a premier think tank institution of the Ministry of Health and Family Welfare in the Government of India. Gentlemen, welcome to our show. Well, Dr. Gopal, I'm going to come to you first. In your opinion, what is the importance of building a healthy India and how does it really affect the growth of our entire economy as well? Because at the end of it, if you can also elaborate on some of the key concerns that really has affected the overall Indian healthscape today.
Meghna, this is a very pertinent question in the current scenario, current context, because as we have become the most populous nation in the world, we had the distinction of that most populous country in the world. And if you look at the other growing economies, the median age of China is around 37 years and the US is 45 years. And this dividend, we are going to harness this dividend for the coming 40-50 years. That is 2055, we will be having this kind of dividend. And this dividend is important because the economy and the economic growth is related with the human capital. If you are having a healthy population, they can contribute to the economic growth of the population. That's one thing. If you talk about the absolute numbers, around 60 crore population is in the age group of 18 to 35 years. And if you talk about the working population, it is going to become 60% of the population. That's the working population. And this contributes to the human capital, and the human capital contributes to the economic growth. As we have seen during the COVID time also, the working population, they have contributed to the economic growth. And the slump which was happening elsewhere, we could at least resist that slump, and the growth is again rebounds back, and we are now seeing growth also. Apart from that, if a healthy population, the government of India has taken a lot of initiatives for making the people healthy. Apart from providing the healthcare services, they are focusing on the social determinants of health also. You have the Eat India movement, we have the Fit India movement. That kind of movements are there to address the social determinants of health so that the population is kept healthy.
Well, Mr. Ramachandran, Sarva Santu Nirmaya. This is a sentiment which was recently shared by our Prime Minister for a disease-free India through his Ayushman Yojana plan. How do you see India cohesively working towards building that dream into a reality?
First of all, thank you very much for having me on your show. I couldn't agree more with the Prime Minister's sentiment. And if I extend this to his vision of a 5 trillion economy for India, I do believe making sure that we have every Indian citizen who's healthy, that's a necessary prerequisite for us to achieve our economic condition. And I think the government is playing a very, very important role towards the realization of healthy and productive Indians. Through the Ayushman Bharat program, more than 100 million Indian families are being targeted for access to quality healthcare. Equally importantly, this program, through its health and wellness centers, also targets the preventive and promotive aspects of healthcare, specifically for people who have chronic conditions. Now, when I view this in parallel and in conjunction with what the chairman of the insurance regulator is driving, which is health insurance for every Indian family, I do believe, and I'm very excited, that the private sector will play an equally important role towards our ambition of a healthy and productive Indian, so that we move towards becoming a 5 trillion economy in short time.
In fact, let me then take that across to Mr. Saluja. Well, it is being said that your dentist can be your first line of defense in spotting the symptoms of a wider health problem in the rest of your body. So is there a link between dental health and your overall well-being, and what is that connection?
No, great question, Meghna. Fantastic. See, mouth is the gateway of great health to a body, right? If you don't have healthy teeth, you don't have a healthy mouth, chances are the nutrition that you're taking is not going well down into your system. You're not able to chew well, and therefore you're not getting the benefits of nutrition. In fact, 1 in 4 Indians say that bad oral health care is affecting their daily life. Now, that's a very large number, whether it affects them emotionally or in a health parameter. Imagine we could have a happier and a healthier India if the mouth was in a healthy condition. So, oral health care is very important. Unfortunately, like you said in the beginning, it is neglected. Only 5% of Indians go to dentists regularly, and that really creates an impact here. Oral health is also very important for actual physical health here. Happen in US because of cardiac arrest triggered by a dental infection here. So you can imagine if that's the impact on something like that, how much overall health can get impacted by this here.
Well, Dr. Gopal, you touched upon this, and that is very significant. The kind of initiatives which are being taken up by the government to improve oral health of the country. If you can just elucidate a bit about that.
Thank you, Meghna, because as my previous panelist, she has mentioned that the mouth is the entry for a healthier population. The government of India also, in the policy, that is 2017 policy, it has also envisaged to have a oral health, alignment with the oral health programs. In fact, since 2014 onwards, we have a oral health program which aims at strengthening the existing system. We have a vision to set up dental care units in all the districts. As well as from the district, we will be taking it down to the sub-district level and the sub-retail. It is a public sector thing. And if you talk about the dental services also, now you see in the private sector, they are also coming up. Apart from that, for promoting other things, we are now coming up with oral health policy. So that means that is in the drafting stage, and slowly you will be seeing more about that. Apart from that, a Center for Dental Education and other things have been created for promoting oral hygiene in this. And the major flagship program of the government, that is the National Health Mission, that is supporting the establishment of the dental care units in the district hospitals. Currently, out of the 730 district hospitals, we have saturated around 650 district hospitals with the dental healthcare unit. Essentially, we are providing the dental chair and the manpower. Manpower comprises of dentist, the hygienist, as well as the assistant. All the three are there, plus few of the consumables are being supported. That's from the government side. As in the initial remarks during the opening statements, as you have mentioned, the out-of-pocket expenses. Because unless and until these services are provided, how you can reduce the out-of-pocket expenses, which act as a catastrophe for the families and other people.
Absolutely, because it does have a cascading effect later on in the family budgets as well. But that's great that these kind of initiatives are being taken, especially when you talked about the oral health policy. Hopefully, that's going to go a long way, isn't it? But Mr. Saluja, if I can ask you about the kind of steps which have been taken by private companies as well. We just heard what the government's doing. What about the private companies, for example, Sensodyne? How are they contributing to strengthening dentistry in the country?
So I think the government is doing a phenomenal job, and my compliments to the government first of all. Yeah. From a corporate perspective, and specifically from a Sensodyne perspective and a Haleon perspective, I think the key thing is to bring the agenda of oral healthcare right on top of mind of the consumer. Because people don't think too much about this particular issue, while this is the gateway to your overall health. Yeah. So how do we educate people more about sensitivity? How do we educate people more about oral health care is one of the biggest agenda that we have here. The other agenda that we have is to help dentists get better education and material on the latest technique of dentistry and how to look after their patients even better. Yeah. So that's one program that we run. We try and get global webinars organized to educate dentists and get them to participate in them to improve their knowledge base here. Lastly, what we are trying to do is trying to support the number of dentists we have in India, and we have a lovely scholarship program which helps the underprivileged student study dentistry.
And that's interesting to see how those who may not otherwise have access to this kind of dental health care, is good to see that both the government as well as the private sector are now stepping in to ensure that last mile connectivity even to those who may not be just as privileged. So Mr. Ramachandran, how is Nevabupas playing its role in ensuring that it is giving every Indian the confidence to access the best possible healthcare facilities and to make them understand how critical it is to ensure that there is a healthier India?
So as a company, our purpose, and this is something that resonates with every employee of Nevabupas, is to make sure that we give every Indian the confidence to access the best healthcare. And we do this through 3-4 mechanisms as a company. Number one, our promise to policyholders, to customers, is that we will continuously come up with innovative and unique products suited to every segment of customers that we offer our products to. So for example, if somebody is diabetic, our product would be different relative to somebody, for example, who's a senior citizen. So innovative and segment-based products is one mechanism that we give every Indian confidence. Second, our industry, as you are aware, is built on trust. And trust comes from providing great services, importantly in insurance, making sure that we do an honest job on claims. And here I'd like to make a point on behalf of the entire industry. The public perception is that health insurance does not pay claims. The reality actually is something quite different. For example, during COVID, the industry settled close to 30,000 crores worth of claims, which I think is a very, very important affirmation of the promise that we make as an insurer, that we will stand by our customer in their hour of need. As a company, as an industry, for most part, I do think our intention is to do that, and our execution has also been in that direction.
Well, that's been back to our show. Nevabupas Health Insurance presents Times Network Living Room Conclave India Health Mission, co-presented by Sensodyne, building a healthy India. Question for now, both Mr. Ramachandran and I am going to come across to Dr. Gopal as well. I'll start with you, however, Dr. Gopal. You must share with us your observations on the kind of, we've seen, ever-growing Indian insurance industry. You touched upon it. How has the customer mindset of young Indians, however, changed in the recent years when it comes to insurance and the kind of adoption rate that Indian insurance sector has witnessed in this age group?
Meghna, this is very tricky and difficult question to answer because during my previous assignment with Niti Aayog, where we published a report, full-fledged report on the missing middle population, insurance for the missing middle population, where we have highlighted that the nuances, like why this insurance sector, though it is increasing. Previously, when I was handling an insurance program in the state of one state of the country, it was 3% penetration at that time. Now it has more than 10% penetration, but long way to go. But as a result, we can't be, because we are signatory to universal health coverage, wherein the financial catastrophe are to be handled. So financial catastrophe can only be addressed if we do have some insured or an assurance mechanism. The government has provided an assurance mechanism through this PMJ, Pradhan Mantri Jan Arogya scheme, wherein 5 lakh insurance is provided to a family on a floater basis. That is addressing to around 60 crore population. And the other 10-20 crore population is also covered through one means or other means. And 10% population is having this retail insurance or the private insurance or a corporate insurance. But a significant population, around 20-30 crores, they require some insurance mechanism. And this population is working. They can pay, but they are not aware about what kind of products they should be subscribing. Apart from that, if you talk about, there are many other challenges in the insurances which is impacting the adoption as well as the further wider spread of adoption of this insurance products among this population, because this segment is very high. That is around 20-30 crore population is still left without any insurance cover. So neither they are poor, neither they are rich, neither they are interested in insurance products. So
that's significant.
It's a significant.
Chunk.
We have to see that how we bring them into the insurance bracket so that they can also contribute.
So that's a huge challenge, that 20 to 30 crore Indians do not have this kind of a medical cover. So Mr. Ramachandran, if I may ask you the same as well, how have you observed the change in the Indian insurance sector in the recent years?
So look, I've been involved in the Indian insurance sector from 2007. And since then to today, I think one dramatic shift that I have seen in health insurance specifically is increased awareness. Certainly COVID has helped accelerate what was a secular trend, but certainly today I think every Indian is aware of the need and importance of health insurance in their financial protection arsenal. So that's point number one. The second thing is, in terms of products and services, I do think as a company, as Nevabupa, as well as an industry, we've become much more innovative, much more service-oriented, and that I think is an important and good shift that I personally witnessed in the industry over time. A related point is the embrace of technology. Today as a company, when I look at where we were 5 years ago versus where we are today, we are much more digital, much more technology-oriented. Again, this is a shift that I notice in our own company, indeed something that I've personally driven, but is also the case with the industry at large. Insurance is no longer a laggard when it comes to technology use, but I would argue at the cutting edge of the use of digital and technology across the value chain. Last, but perhaps not the least, one trend, especially in health insurance, I've observed, is that increasingly India is becoming a marketplace for specialists. In 2007, the first standalone health insurance company came into play in the market. And today, if you looked at retail health insurance, more than 50% of the market is written by specialist companies. This is a trend that's played out globally, and it's happening as India as well. So some of my high-level thoughts in terms of some of the trends that have played out in the last 10 years plus in insurance, specifically health insurance in this country.
So let me go across to you, Mr. Saluja. Why do you think that there are key stakeholders when it comes to building a robust health and specifically the dental aspects of this, an ecosystem in India? According to you, what can be further done to improve the state of oral healthcare in India if 20 to 30% still do not even have insurance?
It's all about, first, a very key intent by all of us to make sure that we bring this agenda right to the top here. Secondly, the most important thing is to have more dentists here. If we have more dentists, then access automatically improves here. Thirdly, we have to bring down the cost of dentistry down to bring access in India, because in villages of India today, the access is very low. In urban India, the access is there, but it's very costly. So bringing down the cost, taking it deep down to the rural India is critical. And I think all of us need to work together to create that ecosystem that you talked about, whether it's the government bodies, whether it's the corporate world, or dental associations like IDA, who are really supporting and driving this agenda here. So it's all of us coming together, bringing down the cost down, making more dentists available. I think that's what is going to make the Indian mouth even more healthier.
And finally, one last question, Dr. Gopal. How can a partnership between the Indian government and private health insurance companies, we've spoken about both of them separately, but together, how can they increase the adoption of medical health insurance in India?
In fact, when the government roped in the private insurance players through RSBY scheme way back in 2008-9, that gave confidence to the insurance player that yes, these kind of partnerships can work. At that time, the insurance coverage was very low, that is 30,000 per for a family of 5, with an insurance premium of around 1,500, 2,000. That was the kind of thing. But after the PMJ, where the family coverage is 5 lakhs, some of the states most of the states have gone into assurance mode. That means the hospital usually does the expenditure, and the state nodal agency, they usually pay this. But some of the states, they usually insure, they have gone into a hybrid mode. That means a part of this 5 lakhs, they are going to an insurance route, and the remaining money, the top-up money, is coming to the assurance mode. So this has given a good public-private partnership between the government insurance program and the private insurance players. Apart from that, as I mentioned in my other thing during my previous assignment, when we have published this report, we have been requesting reforms in the insurance regulation also, because the adverse selections as well as the distribution challenge, product distribution challenges, how to make the cost affordable. Most of the middle section, they can afford a product which can be cost less than 10,000 rupees. But most of the insurance products, even if you go and buy an insurance product, that won't be costing less than 15,000, 20,000, or it can go up to 60,000 rupees for my age if I want to subscribe to an insurance product. If that kind of exorbitant costs are there, and majority of the population earning less than 40,000 rupees per month, then how can a person afford an insurance product? They have to crack this issue, address the distribution challenges, otherwise the market is there. The 30 crore population or the lives are to be insured, and that's a big number. It's not a small number.
Absolutely. In fact, that's been a very enlightening take on how really to build a healthy India. As Mr. Saluja has said, that a healthy mouth is perhaps going to be the way to a healthy India, isn't it? But also a more prosperous India. Ensuring a safe future should be the mindset for anyone who wants to be prepared for medical emergencies. Well, that's it for us here on Times Network in our episode, The Living Room Conclave, India Health Mission. Thank you so much for watching.